Is there a particular age that we need to start screening ourselves, and how, what are the tests that are involved?
If the patient is type 1 diabetes, if it's diagnosed, then at least within 5 years he is supposed to be screened for retinopathy. But if the patient is type 2 and he is developing albumin, producing albumin in the urine, then immediate screening is required in such patients, because usually nephropathy is the later complication of diabetes. Retinopathy is the first complication usually seen.
And at what age do we need to start screening for diabetes? If we're going to do an annual screening, is there a certain age that we need to start, say 30 or 40?
It's 45. After age of 45, if the patient is fit, if the person is fit, then he should screen after every 3 years.
Okay.
Even if he is fine, if the blood sugars are well under control, then he should screen every 3 years. But if the person is obese, if his lifestyle is sedentary, less physical activity, no exercises, then such patients should screen themselves annually.
After 45?
No, whenever possible. Even if the patient is in his 30s and he is overweight, then annual checkup is better to be done.
Okay.
But if he is fit, then after 45.
And how, what kind of a checkup? Are there any reliable at-home tests, or is it always a lab test?
At-home test is also a good thing, but I'll prefer go to a lab and give a fasting PP, HbA1c and urine routine. This is the basic test I will prefer, just to monitor at home. If those are abnormal, then someone may consult a physician or nearby doctor for further management of that.